Assalamu alaikum. I'm Dr. Mamoona from Bahrain Specialist Hospital, your gynecologist. So today I wanted to discuss about vaginal birth after cesarean section. As we all know that once you have had a cesarean section to deliver your baby, your risk of delivering vaginally becomes a little less, but it's quite good still. That means you can deliver around 75% vaginally after one cesarean section. So once a patient comes in and she comes to me and she says that she has had one cesarean section and she wants to know her options. Can she deliver vaginally or does she straight away go for cesarean? So obviously it varies from person to person. So it's not the same for one person and the same for other person. What we do is we know that when a person comes, we give them two options. One is either repeat cesarean section immediately, or the second is vaginal birth after cesarean section. Now, in both of the cases, we have to know that the pros and cons of both. So if a patient is opting for vaginal birth, there are certain things which are better by choosing this exception. So the patient may experience less pain. She'll be easily mobilizing like it's a normal birth. She may have early recouping and going home, and she may it will be easy for her to deliver the next baby or the coming babies vaginally because she has only one cesarean and she has delivered after that. So the blood transfusion risk is less. But we know that there's one thing which is which is the main concern for us and the patient, is that the previous scar or the previous stitch line where we give the stitches in the uterus, there's a risk very less, which is almost 0.5%. That means if 1,000 women will go for normal delivery, only 5 of them can have that scar rupture. So even though it's very less, but it is quite fatal for both mother and baby. So we do not know which of the patients will end up with that. So this is why this is something we have to discuss with each other. We talk about what are the priorities for the patient and then choosing the right patient. So we have to know that we cannot go for vaginal birth in a complicated case. It's not recommended. For example, anyone with high blood pressures or high sugars, or anyone having any other additional problem along with the pregnancy, and any patient who has had any other surgery done in the gynecological area. So also we have to know the patient's previous reason for the surgery. So when patient had her cesarean section done, we must know what was the reason. So if the reason of that cesarean was breech, for example, the baby was just upside down in the tummy, so we had to deliver it by a cesarean. So the success rate becomes very high, around 90%. Similarly, if a patient has had one normal delivery before or after the cesarean section, then again the success rate goes high, 90%. But in case any patient has had a difficult delivery in the last one, she was fully dilated for a long time, she was in labor, prolonged labor, failed vacuum, or maybe there was a second stage problem, like when the mouth of the womb was full open, 10 centimeters. So in those cases, the success rate falls down almost 15 to 20%. So we must know that it's again varying from person to person, and who is a candidate or not, you have to discuss with your doctor what is your what are your options and what is best for you. I hope my talk helped you. So if there's anything else, please do visit. Take care. Bye-bye.